for people looking for health insurance who have missed the open enrollment period or looking for alternatives, there's a handful of plans out there. Number one is an indemnity plan. Aflac is the best example of this. Aflac doesn't try to just be health insurance. They are meant to work with a health insurance plan. If you have a high deductible plan through work, Aflac can help pay some of those expensive expenses. It's not a copay. If it says $50, that's the amount it pays towards the service. There's companies out there, Philadelphia American, Freedom Life, Manhattan Life, United Healthcare. Are they better than nothing? Yes, but my personal opinion, they can be kind of risky to have on their own, because if it's just $1,500 a day in the hospital and you had open heart surgery that's $500,000, they're going to try to convince you that the network, United, Cigna, Aetna, whoever's network the plan's using, that they're going to negotiate the rate down and it's going to pay enough and you'll be okay. And maybe you will be, but for a lot of people, that unknown is scary. Network negotiation can be powerful. On average, it's 40 to 60%. If the hospital's charging $30,000, the network's going to work that down 40 to 60%. To me, that's still not the same as having an Affordable Care Act plan. There are certain protections. It has to cover pre-existing conditions, network restrictions, price. I know these can be barriers. I do believe in indemnity plans when used with a high deductible plan. I have one myself, and it can work very well if you coordinate properly. The other type of plans out there are association type plans. These are your Christian ministry plans, your health shares. The health share approach is more of an exemption from Affordable Care Act law. You become a member of that association and you get access to those benefits. The issues I find with health shares is you're agreeing to those terms, and if you live your life differently than how their beliefs are, that health share can refuse that claim because you are agreeing to their terms. They don't use typical health insurance terms like deductible. They'll use terms like member responsibility. Do they have their place? There's a couple plans that I've used in the past, unions that are looking for membership if you fit within their classification. But again, you're agreeing to those terms. It's not the same as a plan from the marketplace, from Blue Cross. The reason why those have open enrollment periods is because before the Affordable Care Act, you could buy insurance any time of year, but you had to qualify for it based on your health. When the Affordable Care Act came out and said everyone's the same other than their age and where they live, the only recourse the insurance companies had is only enroll during a certain time of year, or if you have a qualified event such as losing coverage within 60 days or losing Medicaid. The Affordable Care Act isn't perfect, but it has the coverage, especially if you're sick or have pre-existing conditions. I wouldn't be playing with these things if you have high expensive medications. Check out our website. We do offer some of those. We primarily do Affordable Care Act plans. We're happy to go through your options with you. Do it for me insurance.com.